The bone health sensor focuses on your risk of osteoporosis, so developing brittle bones with increasing age. And this is also very strongly genetically influenced. So in the introduction section, you can read up on the concept of osteoporosis and how common it is. And if you click on summary of effects, you're going to find some information about your own personal risk. So here you will find an average risk bar, which means that having a genetic risk for osteoporosis is not uncommon. So the average population already has some genetic risks. Some have more than others and have a higher risk, but others might also have lower risk causing genetic variations than others, and they are actually protected from the disease to some degree. So depending on where you are, this tells you how important osteoporosis prevention is for you based on your genetic profile. Now, should you ever develop osteoporosis, there are a number of medical treatments, certain drugs, and the effectiveness of these drugs are also very strongly influenced by certain genetic variations. So bisphosphate, which is a certain therapy that can be used, might be less effective or more effective, and also your capacity to absorb calcium might also be influenced. So some people tend to intake lower amounts of calcium due to certain genetic variations, which are linked to lactose intolerance. And if you're already taking in lower amounts of calcium, which is very important for maintaining strong bones, then you have to counteract by changing your nutrition to increase your calcium intake, and possibly by increasing your calcium intake through supplements as well. And if you then click on prevention, here you will find some personalized recommendations of what you should do to maintain strong bones. It will tell you about nutritional advice, as well as doing exercise that puts strain on bones, because bones that are put under strain tend to build up into stronger bone tissue. And these recommendations will help you based on your genetic profile to reduce your risk or your likelihood of progressing to brittle bones with increasing age.